We often move through the world assuming our eyes function like passive video cameras, recording an objective physical reality and streaming it into our heads. But in 2005, a 67-year-old woman identified as Mrs. AST arrived at a London hospital with a condition that challenged that entire framework. After radiation therapy for a brain tumor, her visual cortex was effectively destroyed, leaving her clinically blind. Despite having no sight, she insisted she could see clearly. She described newly built villages appearing outside her window and attributed her habit of bumping into furniture to poor hospital lighting or simple clumsiness. Neurologists diagnosed her with Anton syndrome, a rare neurological state where a person is totally blind but remains vehemently unaware of it. Her brain was manufacturing a localized, convincing reality from nothing. It forces us to ask, if a brain can invent an entire world and believe it, how do we know our own consciousness is telling the truth? To find the answer, we have to look at a contrasting medical mystery. Consider an elderly man who lost his sight to cataracts rather than brain damage. He began seeing vivid, surreal hallucinations, miniature Victorian men and women walking across his tables, and tiny birds fluttering around his room. This is Charles Bonnet syndrome. Unlike Mrs. A.S., this patient realized the miniature people were fake. He kept quiet about them only because he didn't want his family to think he was losing his mind. Both brains are hallucinating rich 3D environments to fill the darkness. But why does one patient accept the fake news as absolute truth, while the other recognizes the lie? The video camera metaphor fails to explain this because it ignores the brain's role as a proactive guessing machine. This diagram illustrates predictive coding. Because raw sensory data is delayed, higher brain regions project an educated guess downward, filling in the world before data arrives. When visual input stops, the engine keeps running, transforming residual neural static into random memories of miniature people. These hallucinations are simply the brain's prediction engine attempting to do its normal job without any incoming data to keep it on track. Healthy brains use the physical body to stress test these predictions. A Charles Bonnet patient doubts their vision, so they reach out to touch the miniature person, only for their hand to pass through empty air. This creates a sensory mismatch. The visual system predicts an object, but tactile feedback returns nothing. Higher brain centers catch the error and flag the image as a hallucination. In Anton syndrome, however, the damage often extends into the parietal lobe, the region responsible for cross-referencing these different senses. The Anton's patient believes the lie because the biological hardware required to generate doubt has been destroyed. Skepticism isn't just a mindset, it's a specific neural circuit. This realization turns the mirror on us. Normal perception uses the exact same top-down machinery as the hallucinating patients. This cube illustrates how the brain edits reality in real time. The center tile on the bright top appears brown, while the shadowed tile appears bright orange. But as the surrounding squares disappear, the physical truth emerges. Both tiles are the exact same gray-brown. Our perception presents a self-generated 3D simulacrum, favoring evolutionary utility over objective physics. We are all essentially living within a highly successful, healthy hallucination. This subjective simulation raises a problem of isolation. If we are each trapped in our own private world, how do we ever agree on a shared reality? We escape that isolation through constant physical interaction. By moving through space and touching objects, we ensure our multi-sensory feedback loops align with the world outside. Shared language provides the final reality check. It allows us to sync our private simulations, agreeing that a piece of food is rotten, for example, even if our internal experiences of that rottenness look different. Consciousness serves as a brilliantly practical, curated story, a narrative that keeps us from walking into walls and helps us navigate a shared world together.